Welcome, and thank you for taking the time to view this video introducing Module 5 of Alcoa's Leaders Toolkit for Healthy Living Workshops for Older Adults. This is the sixth in a series of 7 videos that have been created to guide you through the introduction and modules of the toolkit. Module 5, Mental and Emotional Health, is important because of the link between mental health and chronic disease. The toolkit provides you with the necessary content and activities to facilitate the workshop on your own. If you feel comfortable covering this topic, we've included some background information for you to use as well. Your role as the facilitator can be to tie mental health to physical activity and healthy eating. If you feel you need additional support when facilitating this module, we encourage you to ask a public health nurse or someone from your local division of the Canadian Mental Health Association to attend the session to talk about mental health. When selecting the guest, be sure to inform them, without breaking confidentiality, of the dynamics of the group, the barriers, and strengths. The speakers should be reminded to tailor the discussion to the issues impacting older adults. When we think of health, we often think of the physical aspects. However, health is not just the physical. It also includes spiritual, emotional, and mental health, each equally important. Mental health is the capacity to feel, think, and act in ways that allow a person to enjoy life and to deal with life's challenges. Older adults, as with all individuals, will experience ups and downs. However, this stage of life can present additional challenges and issues. As a community leader, it is important to be aware of these life transitions and the mental health challenges that may be faced as people age. If someone is experiencing mental health issues, it should be addressed first, as they may impact a person's interest and ability to improve other aspects in their life. Although depression is the most common mental health problem in older adults, it's not a normal part of aging. It's important to dispel the myth that it's a typical consequence of aging and to emphasize that recovery is possible at all ages. In addition to depression, changes in moods, behaviors, and thinking may also indicate other mental health issues. Living with a physical disease can impact mental health. For example, participants in your group who live with diabetes should also be aware that emotional stress caused by excitement, anger, worry, or fear could cause an increase in blood sugar. Physical activity helps to control this. At the same time, physical activity is an important part of promoting mental health and brain wellness. If you're not a mental health professional, don't worry, no one expects you to become one. Your primary role is to be aware of the warning signs for depression that may make an older adult more prone to be at risk for suicide, and to make referrals to appropriate resources and other healthcare professionals. It's important to support older adults, to encourage them to seek help from a healthcare provider, and to ensure that they do not feel that these changes in their mental health are personal weaknesses or shameful. Without mental health, there is no health. An important message to remember and share with your participants is that mental health can be promoted and improved at all stages of life, even if someone currently lives with a mental health problem or illness. If you notice a participant is concerned about growing older, you can check your local library or bookstore for additional resources to share. There are also professional counselors who specialize in the problems of aging. If you need more information about resources in your area, contact a community organization such as the Canadian Mental Health Association for additional support. Thank you for taking the time to view this introduction to Module 5 of the Leaders Toolkit for Healthy Living Workshops for Older Adults. We also invite you to view our other introductory videos specific to each of the 6 lesson plan modules. In addition, we have a video introduction to the Community Leaders Guidebook for you to access. The Active Living Coalition for Older Adults is located in Shelburne, Ontario, Canada. Our website content is available in French and English, and we also have additional resources available in Italian, Punjabi, Spanish, Simplified Chinese, and Traditional Chinese. Enjoy living actively!